Good afternoon, everybody. First one of these I've attended. I've only got 50 or 60 slides. I've got one. So you may be wondering, what? Can you hear me okay if I'm wandering around? You may be wondering what malaria control operations and public health type things have to do with invasive species. But today, currently, especially with the concerns about Zika virus, they definitely do. I wanted to just provide just kind of a snapshot of what me and my lab group do with the study of emerging and resurgent zoonoses and anthropogenic diseases. Mainly, we look at not at the necessarily the molecular level for the research, or we look more in the transmission dynamics in the environment, how things may become exposed to these pathogens, become infected, how they may move it around in the environment. Currently, we've got, well, actually I came to Texas Tech in 2002, and we started, West Nile virus had not reached this far west yet. So as soon as I got here, having done a lot of that work on the East Coast in the Navy, we started collecting mosquitoes and screening for West Nile virus. We found it and have been collecting mosquitoes, screening them for West Nile virus, St. Louis encephalitis, and some other arthropod-borne pathogens over the years. Got this huge, great database on all the collection parameters for the mosquitoes that transmit West Nile virus. Recently, if you remember last year, there was a big scare, for lack of a better, more academically accurate word, about Chikungunya virus being the next, causing the next zombie apocalypse in North America, north of Mexico. Well, it didn't pan out. Zika virus, it's got everybody's attention. For the first month or so, CDC downplayed it as just another mosquito-borne virus, not that bad. Started getting reports of microcephaly, Guillain-Barré syndrome, effects in people. Now, past few weeks, we found out it's sexually transmitted, and that virus may stay viable and hang around in semen for 90 days or more. Don't know yet. It changed a lot of thinking about diseases or viruses, the arboviruses, the arthropod-borne viruses, like Chikungunya, dengue, Zika, how they move around. Because Zika virus was not in the New World until June, or first reported June 2015 in Brazil. That's how rapidly it's exploded and got into the native mosquito population and being transmitted or moved around, transmitted in the environment. The unique thing about these viruses is there's not zoonotic in the urban cycle, so to speak. They're a mosquito, man, mosquito transmission cycle. West Nile virus, as you probably know, is birds, mosquitoes, man, birds. They move around. Humans are incidental or accidental hosts. With the West Nile virus, when it was first introduced into North America from the Old World in 2002, or in 1999, it primarily caused West Nile fever. Since then, until today, that virus has shifted or drifted and primarily causes West Nile neuroinvasive disease. I tell you that because a lot of the same concerns are coming up right now regarding Zika virus, how it may change in the New World species or the New World environments as it establishes itself. Okay, so we get talking on it. So I'll move on. Feral swine. We have a large project, speaking of invasive species, with feral swine. We've got a project with the Noble Foundation in Oklahoma We had started looking at screening feral swine samples from Crosby County down around Fort Hood several years ago. In Crosby County, we found that 50%, roughly 50% of the feral hogs we sampled, and this was out of a population, we sampled about 40 pigs for that. We found 50% were positive for Francisella tularensis. It was no Vacida, it wasn't tularensis tularensis, but that still told us that feral hogs were moving around a lot of pathogens, or could potentially move around pathogens we didn't know about. This project from Noble Foundation, we're screening for, among other things, Brucella species, Trypanosoma cruzi that causes Chagas disease, porcine reproductive and respiratory syndrome virus, pseudorabies virus, and Francisella tularensis. In January, out of 32 pigs we sampled, we found 8 that were serologically positive for Trypanosoma cruzi. We're finding large infection rates for pseudorabies and for PRRS. We've got some that we collected in March that we're wrapping up, not ready to report out officially yet, but we're finding Brucella. And there's, if you may or may not know, there was a brucellosis outbreak in humans north of Dallas last year. And so the Noble Foundation, where we're trapping pigs on the Red River, is just north of that. So we're wondering about how that may be moved around the environment. Wrap this all up. Invasive species like feral hogs, or like the Zika, dengue, and Chikungunya virus vectors, Aegypti Aegypti and Aegypti albopictus, are invasive species of mosquitoes that move in. So I really appreciated your lead-in about the flights, the number of flights coming in and out. It's a constant flow. It's a constant potential that I personally believe is not controllable. We're not going to catch it all. We're not going to stop it all just by the volume of invasive species. And if you bend it a little bit and think about these emerging pathogens, like Zika virus is an emerging pathogen. Dengue's not. It's a re-emerging pathogen because we had 42,000 cases in Texas in 1923, but we don't have it anymore. It's coming back. So if you consider a pathogen that's introduced, emerging or resurgent in an area as an invasive species, it all kind of comes together, and it's really just the scale at which you're looking or measuring. So I'm going to leave time for questions. So thank you.